This is my story, and it's an object lesson in how not to give mental health support to someone who's diagnosed with cancer. It's now nearly 5 years since I was diagnosed with incurable metastatic prostate cancer. I'm still here, thanks to treatment as it's delaying the inevitable. I now know that cancer support services are available, but I wasn't told about them when I needed them. I hadn't seen a doctor for over 40 years. I'd never had any mental health problems, and I lived and worked on my own. My first visit to a doctor, just before my 66th birthday, led to blood tests and hospital visits for more tests, followed by a visit to a urologist who told me that I had incurable prostate cancer that had spread to my lymph nodes and bones. That was it. No information about the likely treatment and the prognosis, no offers of counselling, no referral to cancer support services, just letters arriving at intervals with appointments for more tests. I held it together for a few weeks, but then for the first time in my life, I suddenly fell into a deep depression. And when I did try to get help, I was simply put on a waiting list for mental health services for the over 65s. In November 2021, I went to stay with my cousin in Shetland, and although still extremely depressed, I was being looked after and was being able to function relatively normally. By then I was starting to experience the side effects of the androgen deprivation therapy, including having intense hot flushes. One evening, I was in my bedroom and became alarmed when my vision suddenly became blurred, and for a short time I couldn't see anything at all. I feared that I was having a mini stroke or experiencing some other serious medical event. I don't know what caused it because it was never investigated, but one of several possibilities, including the vitamin B12 deficiency that I was later diagnosed with, is that the side effects of the triptorelin injection that I had just over a week before as part of my cancer treatment. I also have bilateral glaucoma, which seems to make getting help urgent. When I went downstairs to tell them, my cousin and his wife wouldn't take me seriously and wouldn't do anything to get help, despite my distress and agitation. They eventually agreed to phone their GP the next morning. What I didn't know until I got hold of my notes is that the hospital must have been told by the GP that I was being taken to A&E by my cousin because I was acting strangely, not that I had asked to be taken there to have the episode when I lost my vision checked out. Bizarrely, my notes said that I had tried to take a shower fully clothed, when in fact I had been pacing around on the landing outside the bathroom because they were ignoring what I was telling them about my sudden loss of vision. After driving me to Lerwick the next day, my cousin simply left me at the hospital. I'd assumed that he would wait for me while I was checked out, and then we would return together to his house. I can still remember the shock of turning around to see him slowly walking away once he saw that someone was attending to me. I felt totally abandoned by the person who had helped me so much until then. Rather than investigating my sudden loss of sight the evening before, the hospital staff assumed that I had become psychotic as well as depressed. I was never asked about my loss of eyesight or about the triptorelin that I was taking. I was too depressed and disoriented to argue. I now know from my notes that I was diagnosed as having psychotic depression with nihilistic delusions. Nihilistic delusions when I was diagnosed as having terminal cancer. I was kept in solitary confinement in a side room, looked after by nurses who were far from sympathetic. My mental and physical condition deteriorated dramatically, to the extent that I had to be escorted to the toilet, was incontinent on one occasion, and was found disoriented and wandering the corridor one night. People who spoke to me appeared as if I was viewing at a distance through a tunnel. Now that I've seen my notes, I know that massive drugging was the reason. Until my treatment for cancer, I can't remember taking medicines of any kind, not even for colds. I was in the Gilbert Bain Hospital in Lerwick for around 2.5 days in total. I now know from seeing my notes that during that time, Dr. Marilise Jensen, the consultant psychiatrist, prescribed the antidepressant drug sertraline, and instead of increasing the dose gradually as she should have done, trebled it in the time I was there. She did the same with olanzapine, a nasty antipsychotic drug that should never have been given to me and is usually used to treat schizophrenia. On top of that, she prescribed zopiclone for sleeping, diazepam and lorazepam. A sadistic nurse whose face I can still vividly remember pushed extra doses of lorazepam into my mouth to knock me out before the air ambulance flight south, so that I can remember nothing about the journey, although my notes record that I was hallucinating when passing through the baggage handling area at Aberdeen Airport. Drugs.com states that the use of olanzapine is not recommended with sertraline, diazepam, zopiclone or triptorelin, which is a list of almost all the other drugs that I was taking. I was barely able to function physically or mentally. Dr. Marilise Jensen, why the fuck did you grossly overdrug a cancer patient who had become depressed for the first time in his life and asked for help at your hospital? Why did you have me compulsorily detained when I was perfectly fine being looked after by my cousin? I was never psychotic, and your massive overdrugging led to the worst experience of my life at that Royal Cornhill Hospital in Aberdeen. On the 30th of November 2021, I found myself on my own in a side room of 5E ward at the Royal Cornhill Hospital in Aberdeen. Because of the massive overdrugging and unexpected forced incarceration, I was in a very bad mental and physical shape, made worse by being put on suicide watch because they misinterpreted remarks that I made about the sparse fixtures in the room. Throughout my stay at the hospital, I was never told anything about the drugs that I was being made to take. I now know that I was being given high doses of multiple psychiatric drugs at the same time as suffering the side effects of androgen deprivation therapy for cancer. I was deprived of all stimulation, had no phone to contact anyone, no exercise, nothing to read, nothing to listen to, and no visitors. The most powerful drug, olanzapine, is said to produce profound sedation, indifference and lethargy, and this accurately describes my state. I spent most of my time lying on top of my bed and needed help to walk to the toilet and to the dining room, too drugged up to think and having prolonged vivid hallucinations when I closed my eyes. At one stage I needed the help of 3 nurses to get dressed. I was in utter despair about what had happened to me. Dr. Hannah Badil, the main doctor in charge of my care, didn't recognise the terrible effects that the drugs and confinement were having on me, and just recorded my negativity in her notes, while she maximised the doses of sertraline and olanzapine, and added another antidepressant, mirtazapine, without telling me anything about what she was doing. She said in her notes that I was utterly preoccupied with nihilistic delusions. How could she say that of someone who had been told that he had incurable cancer? I now know that Hannah Badil was making preparations to give me electroconvulsive therapy and completed the authorization form on the 9th of December, which was 12 days after I'd started so-called drug treatment. This is an outrageously short period of time. All the literature that I have seen says that the drugs will take much longer than that to have any effect, and that ECT should only be used as a very last resort treatment after all other treatments have been tried and have failed, and always with the full consent of the patient. On the form, she exaggerated my condition to the point of lying, including saying that I had been unwell for around 6 months rather than around 2 months, and that I wasn't eating or drinking or taking medication, which was untrue. She failed to mention that I had no history of psychiatric illness and was started on drug treatment less than a fortnight before. I was extremely constipated and now know that this is a serious side effect, particularly of olanzapine, but also the antidepressants that I was being given. It took around 4 weeks for the doctors to give me any help for this, but suppositories and enemas did eventually get things moving. My notes record that by the 23rd of December 2021, I was adjusting to drugs, engaging well with staff and attending all meals. I was completely unaware of what was going to be done to me the next day. On the morning of Christmas Eve 2021, I got dressed and started to walk towards the dining room for breakfast as usual. I was stopped by a nurse who told me that I wasn't allowed to eat because I was going to be taken for electroconvulsive therapy. I had no warning and no preparation whatsoever, and Dr. Hannah Badil, who I now know to have arranged it all, was nowhere to be seen, and had presumably gone off for her Christmas holidays, or more probably was deliberately avoiding seeing me. I vividly remember being pushed through corridors in a wheelchair, with my strong objections being ignored. I went back to the hospital much later and filmed the part of that journey that is still etched on my memory. I still have flashbacks of the cannula being pushed into the back of my right hand for my first ever general anaesthetic, with no warning or preparation whatsoever. My notes confirm my distress and strong objections. How could those fucking bastards, particularly Hannah Badil, do that to a cancer patient without consent and with no previous history of depression? There was no follow-up to see if deliberately inflicting brain damage with severe electric shocks has caused me any lasting harm, including the possibility of permanent memory loss or accelerated dementia. The notes from my first ECT session show that they failed to induce a seizure despite increasing the current, which may be why my memory wasn't wiped and why I still have flashbacks from then. My notes after the second session show that I was complaining of a reduction of concentration and memory. The ECT anaesthetic assessment said that I had psychotic depression, which was untrue. I had situational depression because of my cancer diagnosis, made much worse by being given large doses of an antipsychotic and 2 antidepressants. My notes show that by the time they gave me ECT, the depression was getting better anyway. My notes for all 4 sessions say that I was continuing to voice objection or was verbally resisting. The notes for the 4th and what turned out to be the final session on the 4th of January 2022 record that I was still resisting, but also that I had a brief period of asystole on the monitor. Asystole is a serious type of cardiac arrest and is particularly worrying for someone on androgen deprivation therapy like me, as the therapy can increase the risk of heart attack or heart failure. I now know that Dr. Hannah Badil not only exaggerated my condition on the form asking for authorization for the ECT, but also the second opinion doctor, Dr. David Rook of Stracathro Hospital, who was legally obliged to safeguard my interests, was guilty of serious professional misconduct, as he lied when he stated on the authorization form that he had examined and consulted me, when he had simply had a video call with Dr. Hannah Badil and never met me or spoke to me. My memory of the ECT still comes back to me from time to time. It intrudes on my thoughts and sometimes keeps me awake at night, which I suppose is a type of PTSD. I was very unfortunate to end up at the Royal Cornhill Hospital in Aberdeen, where the use of electroconvulsive therapy was promoted by the late Professor Ian Reid, a charismatic proponent of the practice, whose publications on brain imaging have been described by others as neurobollocks. The doctors there still have an irrational belief in its effectiveness. A World Health Organization report published in 2023 states that ECT without consent violates the right to physical and mental integrity and may constitute torture and ill treatment. Torture and ill treatment certainly describes what was done to me by the bastard doctors at the Royal Cornhill Hospital, and by Dr. Hannah Baddiel in particular. I shall hate her for the rest of my life, and will support anyone who campaigns for the barbaric practice to be banned. Was it delusion or deliberate cruelty that made her do that to me? Probably both. The short-term detention order taken out in Lerwick expired on the 26th of December 2021, and Dr. Jane Murdoch, my consultant, submitted a form requesting a compulsory treatment order to continue the forced treatment and incarceration. The second opinion doctor wasn't independent, as he was married to Dr. Hannah Baddiel, and I now know that he had a long telephone conversation with Dr. Murdoch. He only gave me a cursory examination. Both certified that I was incapable of instructing a solicitor, and so would have no representation at the tribunal that was held on the 6th of January 2022, and I wouldn't have been able to read and challenge the lies that were written about me. Despite the doctors, I did instruct a solicitor and was gobsmacked to see what the psychiatrist had written about me. They said that I had delusional beliefs about his physical health. I'd been diagnosed with stage 4 cancer, so how was that delusional? Dr. Jane Murdoch lied outrageously. She said that he has poor appetite and requires significant persuasion to eat and drink, believing he will commit suicide by starving himself. By this time I was eating well and had gained 2 kilos in the previous week. My records show that on the very day that she wrote this, I had cereal and toast for breakfast, a 3-course lunch, an evening meal with a main course and pudding, and a sandwich before bedtime, as well as biscuits with tea and coffee. How was this starving myself? She also said that I was experiencing a wish to commit unconscious suicide, as he states that his bowels are blocked, and he will fill with feces and die as a result. This is also nonsense. I was suffering from extreme constipation and was very concerned that no one was giving me the help that I needed. Again, on the very day that she wrote this, the ward GP listened to me and gave me treatment that produced results. How could the consultant in age-old psychiatry in charge of my care lie so blatantly with the intention of depriving me of my liberty and treating me with more electroshock against my will? How could such an evil woman be put in charge of the lives of elderly people? And does she have the same attitude to her other patients? The tribunal was held remotely. Dr. Murdoch was still on holiday and didn't intend to defend her ridiculous statements about me. A staff nurse did speak up about me, and the request for a compulsory treatment order was not upheld. It still alarms me to think how close I became to having more electroshock and continued incarceration. My notes record an instant change in my mood as my depression lifted after suffering 4 weeks of hell, the worst 4 weeks of my life. From then onwards, there is no mention in my notes of the negativity that had prompted the escalating drugging and electroshock. The notes that record that the doctors were not pleased with the outcome of the tribunal. Poor deluded Dr. Hannah Baddiel told me that there was a risk of relapse if I didn't continue with the ECT. I can now go out of the ward once or twice a day to get exercise and fresh air. I walked a long way to explore Aberdeen. I got my wallet and cards back. I had a haircut and bought new clothes, as well as a new phone, a MacBook, a radio and plenty of books. At last I could have exercise, mental stimulation and contact with the outside world. I was still being made to take drugs evening and morning, and I complained about the shaking hands and blurred vision caused by olanzapine. That was the only drug that I was given the name of by Dr. Badil. I had to ask a nurse to tell me the names of all the other drugs that I was being made to take, and Google them from my hospital bed. Dr. Hannah Badil never told me anything about them, as she was obliged to do now as a voluntary patient. For the first time, I went to the Aberdeen Royal Infirmary and met the consultant oncologist in charge of my care for prostate cancer, and found out about the 2 diagnoses and treatment. It was a high-grade cancer and had spread to some lymph nodes in my pelvis and abdomen, but had not spread to my bones, as I was originally told. It was incurable, but was treatable with hormone therapy and a course of radiation, and if I was lucky I might live for several more years. Why had it taken so many months to get this information? I was discharged from the Royal Cornhill Hospital on the 17th of February 2022. Dr. Hannah Badil did not see me before I left, as she should have done, and she still had not told me anything about the drugs, how to take them, and how to safely reduce them. I arrived home that evening and opened the large paper bag from the pharmacy that had been handed to me before I left. It included boxes of olanzapine, mirtazapine and sertraline tablets, with labels telling me when to take them. The doses of mirtazapine and sertraline were still high, although olanzapine had been reduced from its maximum, presumably because of my complaints. My strong instinct was not to take any of the tablets, which turned out to be an excellent decision, as any withdrawal effects were not noticeable as I resumed my life. I had hated the drugged up, unreal feeling that they gave me, and I actually felt much better once no longer forced to take them. Now that I have experienced the side effects of psychiatric drugs, I will never take them again and will react with force if anyone ever tries to make me take them. I have no respect for the doctors who practice the pseudoscience of drug-based psychiatry with no valid diagnostic tools other than their own prejudices and assumptions, particularly the practitioners of old-age psychiatry that I was unfortunate to meet, with attitudes towards their patients that are completely unlike those of medical doctors. My depression would almost certainly have resolved itself with time anyway, and the drugging and electroshock made it much, much worse. In contrast to the abusive care from the doctors, the nursing care and food at the Royal Cornhill Hospital was good, and once the horrors of forced incarceration and electroshock were over, having liberty to explore Aberdeen, to find mental stimulation and have a phone and MacBook to make contact with the outside world helped me to recover completely. I've never been depressed again. If I'd been given more timely information about my diagnosis and referrals to counselling and support groups, my depression would have been manageable and my trauma and the cost of the NHS could have been avoided.